If you've ever had a herniated disc, you know the pain can be horrendous. Many times your doctor will recommend things like physical therapy, anti-inflammatories, and then if you're still having pain, they might recommend an epidural steroid injection. An epidural steroid injection involves guiding a needle using X-ray into the epidural space and injecting steroid to reduce inflammation around the nerve. What a lot of patients don't realize is there's different types of epidural steroid injections, so I'm going to go over that with you today. A little bit of anatomy first. This is the epidural space. It's a potential space in the posterior and anterior part of the spine. It's just outside of the dura mater, which is the protective covering around the spinal canal. So when I do an interlaminar epidural steroid injection, I use X-ray to guide the needle through the posterior ligaments in the spine and into the epidural space. You can see with the injection of the contrast here, the medication is going to spread up and down several different levels. The medication can be a little more left in the center or a little more right, depending on which nerves I'm targeting. This is a transforaminal epidural. So here you can see that I guided the needle with the X-ray to the foramen, or the hole that the nerve root comes out of the spine. You can see with the dye spread that the medication is going to go around this nerve and then up into the epidural space. So when would I choose one approach over the other? Well, really it depends on the patient's anatomy and then their pain symptoms and how many nerves are affected. Overall, the evidence tells us that there's really no significant difference between the two approaches. Epidural steroid injections have been way overused. Our best evidence says that they are the most helpful when used for acute pain and a radicular pattern, so pain that radiates from the back down the legs. They're really not that helpful for low back pain. There are some chronic pain patients that do get relief from these injections when they have them a few times a year, along with other things to control their pain, but that's not the case for everyone, and you should never feel forced to have an injection. It used to be the standard that all patients that came in with radicular pain would get a series of 3 injections, but that's not really the case anymore. Usually if I see a patient for this pain problem, I'll offer them an epidural steroid injection, and if they decide to have one, we do one and we see how they respond. If they don't get relief, then I'm not going to recommend additional injections. I hope this helps you understand what's happening when you're having an epidural steroid injection, and I'm happy to answer questions in the comments.